Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, hello, Detroit Metro listeners and all those from far and abroad that are listening in tonight. We have Dr. Jeff Haddad in the house. Welcome.
Dr. Joe, you covered everybody, yeah. far and near.
Near and far.
Absolutely, that's perfect.
And those in the air. Hey, Jeff, I loved last show that we did.
Yes, I got a lot of responses from that about the bad breath. You know,
we did bad breath.
You forget how prevalent a problem that really is.
Yes,
you know, and a lot of people are self-conscious of it. And no, I was glad we did it. In all seriousness, I didn't really know how it would go over, and I was pleasantly surprised that people were so happy with the information we had. So it's good.
Good info. Hey, I'd like to recap it, but why don't we start our show with a prayer?
Okay.
Okay. I've just flipped to 1 John chapter 4. And confidence before God. This is how we shall know that we belong to the truth and reassure our hearts before Him. And whatever our hearts condemn, for God is greater than our hearts and knows everything. If our hearts do not condemn us, then we have confidence in God and receive from Him whatever we ask. That's important, isn't it?
Sure
we receive whatever we ask if we're confident in Him. And His commandment is this: we should believe in the name of His Son, Jesus Christ, and love one another just as He commanded us. And those who keep His commandments remain in Him and Him in them. And the way we know that He remains in us is from the Spirit that He gave us. So that's a great way to get prayer answered. That's 1 John chapter 3 at verse 19 through 24. So, Lord, we ask that you would guide our words tonight and open the hearts of the listeners, that we'd gain more knowledge and truth so that we can be in better health to serve you to a greater capacity. So with that, Dr. Jeff, if we could recap, we're going to recap a little bit about bad breath.
Well, yeah, at the very end of the show, we started talking a little bit about some, natural remedies. And in fact, I believe I mentioned.
We started to get to that.
Yeah, well, it's interesting because, obviously I know how holistic and natural you really try to live your life. And, as do I.
As best we can.
As best we can. And it's interesting. Usually mainstream does not embrace that, okay? I mean, we're talking artificial anything, right?
Sure.
Synthetic everything. That's what our society's become. Well, it's interesting, though. It goes to show you how important some of these natural remedies are, because there are a big majority of the mouthwashes, big brands, the Colgates and the Listerines and all that, are actually using essential oils and natural occurring elements to enhance their mass, production products, which is a good sign. I mean, if they're embracing it, that's a very good sign.
It's kind of supply and demand.
Yeah.
We're demanding it as a society.
Correct.
And they're starting to bend.
Right? We just got to keep fighting back, rebelling. So a couple things that I want, and I know you're very familiar with these things. I mean, we've talked in the past about clove, clove oil.
I love it. Right.
It's been used for 2,000 years, the ancient Chinese were treating bad breath with clove, and it's a very good option for people.
Right.
Peppermint oil is another great one. Lemon oil. These are a lot of things that, again, I know that you talk about pretty regularly on your other nights of the shows.
Oils, yes.
Yeah, and so
therapeutic grade oils are great to use, and they last so long.
They do, and that's actually one of the reasons why these companies are using them, because some of the older mouthwashes, not only was there a lot of alcohol in them, which dries your mouth out, which actually goes against the fact that you're trying to, hydrating a mouth is going to keep it much healthier, keep your bad breath down, and the alcohol dehydrates it, so it's kind of a catch-22 there.
Yeah.
But these essential oils, they last longer, as opposed to the swish out and 5 minutes later your bad breath's back. So another one along the lines of oils, tea tree oil. I'm not sure how familiar you are with that, but you put 5 drops of that in water and swish around. It's a very good antibacterial, But the interesting thing.
So it is killing the germs that cause bad breath.
That's correct.
Listerine says it does. But then you said it's got alcohol, which is counterproductive.
You're right. There's the pros and cons of that. I'll tell you, one of the tried and true methods as far as going natural, if you want to be natural, it's something that I grew up knowing. It's something that was, reconfirmed in dental school, and even today, we still use it. Hydrogen peroxide. Okay. Great. We talked last week about how these bacteria are anaerobic, meaning they do not like oxygen. Well, hydrogen peroxide, that's what it does. It oxygenates. Your mouth. So you take 50-50, 50% hydrogen peroxide, 50% water, swish 60 to 90 seconds, twice a day, you're going to be in pretty good shape. And I'm going to tell you, not only is it going to keep things healthy, but
is it going to prevent periodontal disease?
Well, I'm glad you asked it. Yes, it's going to help a lot, but please, I don't want anybody listening today thinking that if you do have chronic bad breath, if these are your first lines of defense. Like we talked about it, the most important thing you need to do is to make sure, get to your dentist, be evaluated, and make sure that you don't have periodontal disease. Because no, this alone is not going to cure that. You need, again, a deep type of cleaning. You need a professional cleaning to take care of that.
Sure.
And anything that
I love what you do with the laser.
With the laser cleaning, it's a great way to disinfect. And
hey, Jeff, how much pain is there with the laser?
There's no pain.
There's no pain.
Oh,
they don't feel any heat.
No,
searing.
That's a great point. It's kind of a misconception. Lasers are used for so many things in the world, right?
Sure.
And in dentistry, we use them a lot. And we use them in so many different capacities. When I use them for some of my, gum recontouring. We've talked about really gummy smiles before. I'll use my laser to kind of sculpt that gum tissue a little bit. And it's a low level of heat, but again, people are numb and they don't feel anything. When we're using it for cleaning, it is at such a low level that there is no heat. It's just the light that is using to eradicate any of the bacteria and disinfect the area.
Eradicate the bacteria. I like that, man.
Thank you. There's a $2 word for you. I've got more of those coming tonight.
Yeah. So you're saying we get food grade hydrogen peroxide. Hydrogen peroxide is basically water's H2O.
Right.
Hydrogen peroxide is
H2O2.
H2O2.
Yeah.
You get food grade. You could put a drop of either 5 drops of the tea tree oil or a couple of drops of the peppermint or clove or some of our thieves oil.
Right.
You're saying you can make this very simple, easy.
There's no question.
And there's no alcohol.
Correct.
So you're saying alcohol definitely is not a good thing for the mouth.
It depends what your goals are. Obviously, it can be good for your body in other ways, but alcohol drying out your mouth, no, that's actually going to exacerbate. How about that?
Yes.
The situation. I'm going to keep going with some big words, but it's going to keep this problem because when the mouth is dry, the saliva is not flushing things out and it's not keeping things healthy, and that's where bacteria can thrive in a dry environment. So, no, that's really
staying hydrated is
very important. Very important.
So you said we could use clove oil, peppermint oil, lemon oil,
right,
or this tea tree oil.
Great.
You're giving us a lot of choices.
Life is about choices, options, right? I don't want to ever, stranglehold anybody into one way. People can use their, and again, not to say that some of the Listerines and the Colgate, mouthwash, they're great. They're great for some people. But here's some options for others if they want to go the more natural route. You know, but I don't want anybody to ever think it's a substitute for regular dental checkups, because periodontal disease, gum disease, which is a very big factor in bad breath, like we've talked about in the past, it affects 80% of the population. 80% to some degree. And if it's not treated, it'll get worse, and it's going to get you into a situation, which is what we're going to talk about today. I know you've been eyeing my model here, and for those listeners, I apologize. This is radio, but I brought a little prop in for Dr. Joe, really just so he understands what we're talking about, which is bone really disintegrating when there are no teeth there. And if periodontal disease is allowed to thrive, you lose teeth, okay? Many people have lost a tooth in their lifetime. 69% of people will lose one tooth by the time they are between the ages of 35 and 44, okay? And 75% of the population, when they reach the age of about 75, can actually be completely edentulous, meaning they've lost all of their teeth. And for me,
that's not good.
That is not good. And so when what we're looking at, people, is a model of your teeth and your entire lower jaw. And if you lose your teeth, the sequence of literally the bone disintegrating. You think of that.
It looks like it's a third the size, so it eventually
it disappears.
Which
is a very scary thing. Now, we've talked in the past about what dental implants are, okay? And dental implants are, in my opinion, the best option to replace a tooth if you've lost it. We're actually placing an artificial root, a titanium root, right back into your jaw, building a tooth right back up, and it'll be stronger than probably the majority of the teeth in your mouth. It is successful. It's 97% success rate. It's predictable, and we've touched on that. We've also touched on this 3D X-ray.
Well, that's what I want to know. So you just went to a seminar, right?
I did. I just got back from a big conference down in Tampa about cone beam CT scanners, which means cone beam computed tomography. People have heard of medical computed tomography.
How much X-rays? And when you start mentioning CT scans or that, medical, I try to tell patients, do as little of that as you can.
And that's very good advice. And, I'm glad that you brought that up. I don't want people to think that this is the same technology. It's very, very misleading. These medical CTs, although very necessary in some situations, are literally 10 times the amount of radiation that these cone beam 3D X-ray units are. So, yes, they share the same CT within their name, but they are night and day. Literally what we're using is a tenth of the radiation. A tenth. It's like being in the sun for about an hour and a half, okay? And I'm going to tell you, what we're going to cover tonight is actually a topic we covered when you were on your little vacation, when myself and my partner, Dr. Doolin, we really talked about this technology. But what we never did talk about is how we use this technology when we're doing our dental implants. Dental implants are such an important part of dentistry. And for those of you who are listening who have lost a tooth, maybe even have had a dental implant, I know that you realize that the value of having your tooth back, or really the value of missing that tooth. When your tooth's gone, when you start losing teeth, you start to realize that function and life is not where it used to be. And what we want to accomplish tonight is the fact that we can actually do a computerized virtual surgery on the screen before I even touch a patient. The patient will know exactly what to expect before we even touch them. Think about the predictability. I mean, if you had to go in for heart surgery and they could tell you that they could do it on a computer before, make sure they work out all the kinks before they went into your body, would that interest you?
It would very much interest me.
And we can do that.
It's like a trial run.
Right. I mean, it's unbelievable.
Testing products on animals or something so you're testing it
with the computer.
It works
much less cruel. I love the animals. We'll leave them alone, But no, it is. It's an amazing option.
How is that? I mean, what is the distortion of your cone beam?
There is no distortion.
Really?
There's none.
I know when we talk about the electron microscope, it's
Right.
not only how big the magnification is, but what is the distortion?
That's
Right.
that's a great point. And really, well, let's back up here. The distortion on normal 2D X-rays, which are the traditional dental X-rays that we've been taking, is 25%.
Wow. That's
Now,
significant.
it is significant.
25%.
Not that, when I take an
distortion.
X-ray, I can't diagnose, decay. There's a lot of things that I can diagnose very easily with that, and that distortion is acceptable. But if I'm going to use that type of an X-ray to literally guide my surgery, that's not acceptable. 25% is a big number. This 3D technology that we use, Joe, is a one-to-one relationship. It's exact. It's literally a replica of your entire, whatever our field of vision is.
Right.
I mean, we can put your whole, skull in there if we wanted to. We don't need to. That's overboard. But literally, it's an exact replication of your jaw, your teeth, whatever we're interested in. So I can take that computerized image. And I actually have a surgical mold and guide made, where I literally have the exact measurements, the exact placement. You need to understand these surgeries are very delicate. There's a lot of anatomy there. There's a lot of nerves. There's a lot of bone defects. How about knowing if the quality of bone is good enough, or the quantity of bone?
So
if you have
can tell that on the cone
before we even touch the patient.
Wow.
And I'll tell you, for those of you who are listening right now and saying, "Wow, this is pretty interesting to me," and honestly, there's a lot of people out there who are listening, Joe, that have probably been told that they were not candidates for dental implants. And the reason is that, and maybe this was 5-10 years ago, whenever, they didn't have the technology as exact as it is right now. We can actually do a scan of a patient to tell them if they are a candidate for a dental implant.
So you'll know their bone density.
Well. And
wow.
It's different in different areas of the mouth. I mean, the amount of information from this technology is unbelievable.
So that's where you make you have a lot better success, knowing the outcome.
The success rate is so predictable, and I'll go one step further. If a person doesn't have a certain amount of bone or the proper quality of bone, we know that prior, and we can actually enhance that. We can actually augment that area with a bone grafting procedure or something to that effect. Wow. And then we can check that quality of bone before we go forward. It's endless.
Yeah.
It's just endless. And, what people don't realize is placing a dental implant is – a lot of people think of it as –
So don't you need to be an oral surgeon, Jeff, to do this? I know I'm –
No, that's
interrupting you.
No, I really, that segued perfectly, because yes, a lot of people think that, and oral surgeons do place implants, but there's a lot of people in dentistry place implants. You have oral surgeons, you have your gum specialists, even some root canal specialists. If a tooth is not savable from a root canal, some of them will even place a dental implant. But the majority of dental implants in a lot of arenas are actually placed by a general dentist. But you have to have the proper training. You know that I'm always in school. I mean, The last 2 weeks I've been at 2 completely different conferences covering 2 completely different arenas in dentistry, but one of them was dental implants. We've been placing dental implants in our office for almost 20 years. We are very successful, and it's kind of nice for our patients to have it all done within one roof, because I know what the tooth needs. I have to build the tooth. If an oral surgeon or a periodontist, which is a gum specialist, if they place the implant, the dentist, myself, still needs to build the crown and the tooth above ground. So it's kind of nice when I'm able to not only do the surgical portion, but I'm also able to build the tooth, because I know where I need to get to.
You're doing it from ground floor up.
You got it. And patients appreciate that.
Yeah.
It's very nice to have that control and to have it so predictable to a point where literally I've had patients that I've done dental implants on, and because of this technology and because of the planning and because of this computer guiding me, they're taking Advil afterwards.
Wow.
That's it. A surgery. It's a walk-in, walk-out. They're numbed up. I've had people who didn't have to take anything, because we're not making incisions. We're not doing all that stuff that a lot of times in the past was necessary, because you had to open things up to see what you're doing, right? But you don't need to do that now. I mean, it's so less invasive.
So you have this 3D scanner.
Correct.
Well, how many dentists have the 3D scanner?
Well, you know what? In Michigan,
Yeah.
not very many. And it's unfortunate because I believe it should be the standard.
What is not very many, like 200-300? I mean, there's how many dentists in Michigan?
Oh, good Lord. I couldn't even tell you. I mean, yeah. I mean, there's definitely in the hundreds. My guess, okay, and this is a guess, and I think it's pretty accurate, my guess is there would be probably less than 10 of these in the entire state.
In the state. Does that include, like U of M would?
Yes, that's including our two dental schools, U of D and U of M. And the reason...
I don't even think U of D has this.
I'm not sure either. You know, I'll have to ask, one of my proteges, Dr. Marco. We're going to have him on a show one time. But, no, there's not that many, Joe. And the reason is this. Our state makes it a requirement for you to prove that you are, I hate to say worthy of it, but you need to have proper training. And you have to be providing services that this technology can help, which are TMJ and headache treatment. Obviously, you know that's a huge focus for our practice. Dental implants. We place so many dental implants. It's another very large focus of our practice. And our third, which, again, we've talked about in the past, sleep apnea. This machine actually shows...
How does that help? Sleep apnea?
I'm glad you asked. It actually can show us airway volume and opening and or obstructions.
So you're really getting a lot of soft tissue.
Unbelievable. And you know that allows us to show a before a sleep apnea patient and then after we've made them a sleep apnea appliance in our office, showing how the airway opens, showing the increased volume, and with that in conjunction with a sleep study shows the effectiveness of our appliances. So this technology is invaluable. I don't even know. It's gotten to the point now where I will not even place a dental implant without utilizing this and utilizing the computer-guided, and it's not that you can't do it. It's not that you can't do it well. Believe me, there are a lot of surgeons out there and dentists who are using 2D technology, and that's fine. I would never knock them. But when you have this available, the information you have, it makes it a completely predictable. There's no surprises.
Well, predictable, but you're saying you don't have to open up to take a
less
look.
Invasive.
Lot less invasive.
Much less invasive. I mean,
I really like that idea.
It is. And most patients do too.
Yeah.
Obviously, when you don't have to go in there and just kind of explore, it is very, very. It's such an advantage.
Hey, so Jeff, with your 3D scanner, so you're not just utilizing this for dental implants. You said, but to evaluate sleep apnea.
Correct.
And what else?
TMJ joints. Our temporomandibular joints. We can see everything. We can see where your, a lot of TMJ. The condyles. The condyles are exactly. There's where your lower jaw meets the skull. There's, as you know, a disc, and there's a lot of tissue there, and the position of that jaw, 9 times out of 10, is what's causing the headaches, the migraines, the jaw pain. And so utilizing this technology and seeing this position or bad position, if you will, allows us to, again, help our diagnosis and, more importantly, see an after view once we've treated it. We use a lot of appliances, jaw orthotics to position the jaw in this comfortable position. I will take a before scan of the patient before I treat them, and then I will take an after scan after I've gotten them comfortable and verify, yes, look at how much nicer the condyles are in the proper position. You could see the proper functioning. You can
see that.
You can see it and you prove it.
To see is to know.
Yeah.
That's really nice.
Very objective, and it's very nice to have that. And it allows us, again, the ability to tell people what is possible if they are a candidate for certain procedures, and to let them know, yes, here's what I can see. And the patients love it. I mean, for you to be part of the process is important for me. I'm not going to ever tell people what they need to do. You don't have to do anything. But when the patient is part of the process, they're part of the exploration, they're seeing their own skull or jaw or whatever we're viewing right up on screen, they become part of that process. It makes them understand it. They own their own problems, and they see what the proper treatment can be.
As a patient, I love that. I always would like to know.
Yeah, the visual is important.
Because how do you can't see, you can't show me
No.
Yeah, I mean with traditional X-ray.
Correct. And that's why I brought in this scary model of a bunch of jaw bones here, because, here's a stat for you. For those of you who are listening who wear dentures, okay, who have lost several or all of their teeth, do you know that out of the top 10 things that Johns Hopkins recommends of being healthier, an overall choice for you to make, number 4, if you are a denture wearer, get dental implants. That may just mean getting 2 or 4 dental implants to secure your appliance.
To secure it.
But people who are wearing dentures, they are only we function at 100%. We talked about this before. Denture wearers function at 10% of their function.
That's terrible.
10%.
Yeah.
If we place some dental implants in there, we can get them up to 90% instantly that day.
Instantly.
Their own
so
denture.
Then they're going to be digesting food better, breaking food down.
Eating nutritional
What a nutritional deprivation, really.
Right.
I mean, not only does your jaw
disintegrate. That's the other thing. A lot of people get, and this is really, again, you were looking at this. Look, it's pretty scary.
We should take a picture of this, put it up, and have Linda put it up for us.
We'll get that on the website. Yeah, because people don't realize, people say, oh, I'm getting along fine with my dentures. They don't realize that every year that goes by, they're losing more and more height and width of that bone. That's literally going to make it to one day they aren't a candidate for dental implants. Please don't wait. People say, oh, I can get them anytime. That's not true. Right now you may have enough bone, the quality of bone, for us to place dental implants. And I don't think we've covered this. Once the implants are in, that bone will stop disintegrating. The body treats these implants as natural teeth.
As real teeth.
It's actually stimulating the bone, keeping it there so that it's not deteriorating over time.
Wow, that's great.
And that's a really
So you
important
definitely do not want to wear dentures.
Dentures are, in my opinion, are about the worst thing that people can do for themselves. Hey,
Jeff, what else? 3D. So you said sleep apnea,
right?
As well. So what else is this 3D imager good for?
Well, all right. Here's something that, it's definitely within the realm of dentistry, but a lot of people don't think of their dentist right away. Sinus infections.
Okay.
Do you know what the number one reason people go to the physician is? Sinus infections. Sinus infection. It's that common. But here's the kicker.
That's the number one reason people go to a doctor?
That's correct.
Across the state, not just Michigan.
No, across the world. As the stats that I found, that's the number one reason that people go to their physician.
For sinus infection.
Now, let's go further with this. Do you know that 1/3 of all of those cases of sinus infections, which is sinusitis, are caused by undiagnosed tooth issues?
Wow, I can believe it. I never thought of that.
And we have that a lot. We have people come in and they're like, my teeth are really, really sensitive. What's going on? And we look, they have a sinus infection. It kind of goes both ways.
Right.
So 1/3 of the number one reason people are going are for sinus infections, but 1/3 of those aren't sinus infections at all. They're actually tooth problems. Now, I'm going one step further.
So 1/3 of the sinus sufferers are their teeth.
Their actual teeth. Now, we'll go one step further. 32% of all of our upper teeth, which is right by the sinus, actually have infections or pathology that are missed by regular x-rays. Wow. 32%. So you've got 1/3 of these teeth, or 1/3 of these sinus infections are caused by teeth, but another third of these teeth have pathology that you can't see with traditional x-rays.
But you can with your 3D.
Yes, you can. With this 3D technology,
That's
find
amazing.
things that 2D cannot.
Is amazing,
Think
Jeff.
about how many people are walking around getting chronic sinus infections, and it's really teeth that are causing them problems.
Well, you know what? I'm gonna have this 3D image of myself.
You should.
And maybe we'll put it on the web, and everybody can look at it.
That's exactly what we're going to do. Look at
Jeff.
you. What a great idea.
That's an amazing stat. Listen, we're out of time, Doc, but the sinuses are 1/3 are due to teeth, and 1/3 of that are missed with traditional x-rays that you can see.
With our technology.
Yeah, that's amazing.
If anybody's interested in this type of information, first of all, again, my website, RochesterAdvancedDentistry.com. There's all kinds of information on this. But if you're interested in possibly having this view of your jaws or whatever done, having a scan, our office number, 248-656-2020. Information is power, and a lot of times the information isn't there until you get technology like this at your fingertips.
I'd like to continue this next week. Dr. Jeff will be on next Wednesday. Thank you, and tune in again tomorrow night. Remember, all that you eat, drink, or do all things to the glory of God.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.